We are back with Elizabeth Golding, Medical Director of Cone Health Palliative Care Services, talking about advanced care planning. So we did talk about how having the documents is key. Not just talking to your family about it, saying, hey, I know you'll do what's right. You definitely want to have the documents. Now, once we have the documents completed, we do still need to talk with our family about those documents.
That's correct. The conversation really, it's a tough one. I think people really, no one really likes to talk about end of life. It's normal. We're human and we, it's a difficult subject to talk about. And sometimes people won't bring it up because they're afraid it will cause their loved ones sadness or grief or just the thought or the idea of that happening. But I always encourage people to focus on the gift of clarity to your family. So letting them know your thoughts on something around how you want to be cared for, what if situations are really good to talk about. And it doesn't have to be a super heavy conversation. And you can kind of start with saying, there's some important things I want to talk to you about life and planning. When's a good time for us to do that? Sometimes people bring it up, at the Thanksgiving dinner table or, with everyone and say, we are going to talk about this. They make a big deal about it. But really, it's a personal decision how you bring it up. But I do find that once people do it, they feel so much more relief about having it done and the clarity and the reassurance of knowing that they have identified a person to help make decisions when they can, and also to have that document that says things like I wouldn't want to be on life support if I couldn't think or speak for myself, or if I had an injury or an illness that I couldn't recover from. I don't want to be a burden on my family. To be able to say that to your loved ones in when you've got your mind about you and you've got your capacity, you're not in the throes of a horrible illness, is so much easier to do it when you're well than when you're really sick and vulnerable. And so I do encourage people to have those conversations early with their loved ones in the event that there is serious illness.
Okay, we've got about a minute and a half or so. What is a misconception maybe about advanced care planning that you would like to set straight while you have everybody here listening?
I think sometimes people assume that if you complete those documents, it means you want to give up or that there's some limitation that'll be placed, on your care. It could not be further from the truth. These documents truly are meant to protect you and to make sure that your best interests are served in the event of a serious illness or a life-threatening illness, where you may be facing very difficult decisions about how you live for the time that you have left. And it really does provide reassurance, not only for the providers caring for you, but also for your families. There's nothing more agonizing for me as a physician than to see a family really struggling with these decisions. It tears families apart when they don't have that clarity. Maybe they don't agree. When really at the time the focus should be on something other than that. If we can get that discussion had up front and we kind of know what someone's wishes are, it makes for just a much smoother care pathway. It also helps families have peace and dignity and reassurance in knowing that they have fulfilled the wishes of their loved one, and that burden doesn't rest on them, and it doesn't rest on them for the rest of their lives. It was something that had already been spoken about. So it's very powerful when people do have these conversations and documents. It always gives me a sense of relief in saying, wow, this person did well for their life by talking to their family. So I really encourage everyone to have these conversations. Most people feel much better after they do it.
All right, have the conversation and get the documents going so that it is more than just a conversation, that it actually is known for those who are taking care of you as well. Thank you so much for joining us. If you missed any of this, if you want to send it to somebody else, this is going to be in the To Your Wellbeing section on our website.